If you don't have health insurance yet, you may wonder if it's worth taking the time to shop for it or spending the money to have it. Let's find out if it's worth it. This is John. He just bought his new health insurance, so let's look at whether or not health insurance is a good deal for him. John makes $26,000 a year. His monthly payment is $100 per month. This payment is called a premium. His deductible is $2,000 per year. A deductible is the amount of money that John will pay before the insurance company helps pay his bills. In February, John goes to his doctor for his yearly wellness exam, which is preventative care. The bill is $230 and his insurance pays the full cost because it's a preventative visit. Preventative care is free. In April, John has an accident and has to go to the emergency room. The bill for his ER visit is $2,000. John has to pay all of this bill because he has not met his deductible yet. John develops an infection from his accident and gets a prescription for medicine that can make him healthy again. The medicine costs $200. John pays $10 because this is his copay for prescriptions and his insurance pays the rest of the bill. John is having a tough year, and in September he has to go into the hospital for a 3-day stay. The cost of the stay is $4,200. John's insurance pays the bill because John met his deductible with his emergency room visit earlier in the year. In October, John has to have a follow-up x-ray. The cost of the x-ray is $600. John pays $10 because that is his copay for x-rays, and his insurance pays the remaining $590. John managed to rack up some big healthcare costs this year. Let's take a look at the final tally to see if John's insurance is a good deal for him. His total for medical bills this year was $7,250. He paid out of his pocket $2,020 of that, and his insurance paid $5,230. Now let's look at John's total cost for healthcare this year with insurance versus without insurance. With insurance, John paid his $100 premium every month this year for a total of $1,200, and his portion of his medical bills is $2,020. This is a total of $3,220 in healthcare related cost for the year. Without insurance, John would have to pay the entirety of the $7,250 in medical bills. So is health insurance good for John? Yes. John saved $4,030 with insurance. John was also able to avoid having to pay the penalty for not having health insurance, so it's an even better deal for him. We will talk more about this penalty in a minute. You may think that John's example doesn't apply to you. If you are young, have never been sick, and think you are pretty healthy, you may still wonder why you need health insurance. Let's take a look at a few reasons why. Most importantly, you get peace of mind knowing that you or family are covered if you ever do get injured or really sick. You are protected from unexpected high medical bills, and you can get the care you need. You also get free preventative services to keep you healthy at no extra cost to you. This includes free flu shots, a yearly wellness check, help to stop smoking, and more. It's the law. Everyone is required to have health insurance now. This means that you may be penalized on your taxes if you don't have health insurance. The penalty increases each year, so if you decide to go without health insurance, you should look into the penalty for that year. The health insurance marketplace, sometimes called Obamacare or healthcare.gov, makes health insurance affordable. The law says that you cannot be charged more because you are already sick or have been sick before. There is a limit on the most that you would ever have to spend out of your own pocket for healthcare. This is called the out-of-pocket maximum. Most people buying insurance on the marketplace can get help paying their monthly premiums. It's like getting a coupon for your health insurance payment each month. Some people are able to get additional help paying other healthcare costs. This help is called a cost-sharing reduction. People who make less money or have bigger households get more help. You can pick the plan that fits your health needs and your budget. You can buy health insurance from the health insurance marketplace as long as you don't get health insurance through your job, don't get Medicare, Medicaid, or VA benefits, are a citizen, or are legally present in the US. You can get help paying for your health insurance if your income falls between certain limits for your household size. These limits are 100% to 400% of the federal poverty level. Do not worry if you don't know what that means. We will give you some examples. For example, in 2016 and 2017, you are eligible for help if your household is just you and you make between about $12,000 and $47,000 per year. Your household is you and your spouse or dependent, and together you earn between $16,000 and $64,000 per year. Your household is you and 3 other people, for example, you, your spouse, and 2 dependent children, and together you earn between $24,000 and $97,000 per year. You can find out if you qualify for financial help by visiting healthcare.gov or by talking to a health insurance enrollment assessor near you. It's free. Now that you know that health insurance is worth it, let's talk about how to get it. You can apply for health insurance on the health insurance marketplace between November 1st and January 31st each year. If you are insured through your employer, Medicare, Medicaid, or the VA, you may have different times that you can enroll in health insurance each year. This period is called open enrollment. During this time, you can shop for health insurance for the first time, renew your current marketplace health insurance plan, or shop around to see if you can find a better plan. You may also be able to purchase health insurance during a special enrollment period. You may qualify for a special enrollment period if you have had a major life change, such as A. Having a baby, B. Moving to a new region, for example, a new state or an area in your current state where your current health insurance plan is not offered, C. Your income changes a lot. If you think you qualify for an SEP, you have 60 days from the life change to enroll. Now you know that health insurance is worth it. If you have questions about how to shop for health insurance, how to find health insurance help, or how to use your insurance, check out our Get Insured, Stay Insured videos. You can also find free local in-person help by going to www.localhelp.healthcare.gov.